Pathogens in the Twilight Zone. What we really were looking at here in putting the program together was just an update on some of the bugs that are more in the news, having more maybe impact on the industry from a point of view of public relations rather than necessarily public health. And this is just as I grew up on the Twilight Zone, I just figured this was the place to talk about it because it's really the sort of great unknown. Are we facing big threats? Are we facing things that don't matter? How do we actually go about assessing, communicating the risks that might be associated with some of these bugs? So just to get things going, anyone who's been around the intensive livestock industries for the last 15, 20 years knows we're under fire from the public and from groups who are opposed to the nature of our business or the way we do business. And there are lots of platforms that we get criticised for. And one of them is very much that the manner of rearing in animals intensively creates conditions for the emergence of new diseases, and potential pandemic words are used, and you'll all be familiar with that sort of literature. In the media, I would say the attitude is largely shoot first, ask questions later. If there's a story to be sold and it's topical, it'll tend to come out all guns blazing before necessarily we know a lot about the risks that are truly maybe associated with it. When we have the internet and the blogosphere, it's one level more removed from standards of journalism, I guess. You can just shoot first and you don't have to ask any questions, and if the facts come and dispel it, well, you can just move on to the next issue, because what you're really doing is looking for material to pepper, and this doesn't apply just to the animal industries, whatever subject that you don't like the look of. So I'd say that the default position for the industry, intensive animal industries, is guilty until proven innocent. If a new issue emerges, there'll be a lot of negative press, and we're playing defense rather than playing offense. And it always takes a little while to unravel the uncertainty that's associated with any new organism, new disease. And that uncertainty is what creates the opportunity for, statements that may be a little over the top. So my position would be, I think, habitually the first response to new reports or new organisms is an overstatement of the real public health risks. Just to say that I'm just not making this up, I'll use a couple of perhaps the most topical examples globally, even though they're not pig examples. BSE. When the first human case of variant CJD was reported in 1996, there was a peer-reviewed modelling study done from Imperial College in London, very well-known epidemiology group, and they came out with a risk assessment that predicted there would be 5,000 to 50,000 deaths due to variant CJD in the next 20, 25 years. And of course, what did the media run from that? 50,000. The lower confidence prediction got lost. So we were talking about, huge numbers of deaths. The global tally after 15 years is about 200. So that's the eventual public health risks end up being way, way, way below what the early and widely disseminated estimates or guesstimates. Bird flu, H5N1, avian influenza, and I don't want to trivialise things. I think anything that happens like this in a food animal industry is very important. It is potentially of public health concern, and we need to really get onto the job and understand what's going on quickly. But again, just to point out that the worst case scenarios are what occupy the media wave. So there are guesstimates there, again, widely circulated, 150 million human deaths predicted as the worst case scenario of the H5N1. As of about 2 weeks ago, the last WHO report, laboratory confirmed cases, they certainly understate the burden of disease, possibly 5-fold, possibly 10-fold, but the total is 564, 330 fatalities. So if you add those two up that were predicted to cause all these human deaths, the tally after 15 years is about the average road death in the United States every week. And so we live with that risk and we never publicise it. And so there's a big gap again between what will be portrayed to the public as their risk and what their risk may be. The difficult thing is we never really know when the big one may come along. And so it's you always have to be reserved. The other thing that's difficult is some diagnosticians in the crowd here. We've got wonderful diagnostic tools now that enable us to find organisms that we didn't know existed, we were unable to culture. And there's bacteriologists who estimate that, we probably only know 1 or 2% of the bacteria that are out there because of the limitations of our culture techniques. Now we just look for DNA, we look for RNA, we have these PCR-type tests, so we can find all sorts of organisms that we couldn't detect before. So that means when we find them, what do they mean? For those with an evolutionary bent, it shouldn't be a surprise, perhaps, to us that when we've got closely related hosts, like mammalian species or homeothermic species, that they will be colonized by closely related organisms. So if we look in the oral cavity, the nasal cavity, the gut, we will expect similar organisms to be occupying those niches in similar species. So we can expect, if we find noroviruses in people, if we go and look in animal reservoirs, we will find norovirus or norovirus-like particles, and that wouldn't be biological surprising. The issue is, do they matter? Are they a concern for us from a public health point of view? So any time we have discovery, we have uncertainty, and we just have more discovery now than we used to. And we have uncertainty about, do these organisms really transmit species to species? And if they do so, what are the implications for health in the recipient species? Okay, I've just got a list here. This is a huge topic. I have half an hour, and I'm going to focus largely on one of them that has been perhaps the most topical, second most topical. Influenza viruses. They're in the Twilight Zone. We get them in birds, we get them in people, we get them in pigs. We have weekly reports, perhaps. You've probably heard of the recent isolates of, new variants that are in kids at fairs in a couple of the states towards the east. What does it mean? Does that mean there's something bad coming to get us? Or are we just able to find these variants now that we're looking and they don't have any important public health consequences? So influenza is probably the poster child, I think, of the Twilight Zone and the difficulty in understanding it. MRSA, methicillin-resistant Staph aureus, that's what I'll spend most of my time on. But other examples, Clostridium difficile, noroviruses, saproviruses, some intestinal spirochetes, and the list can go on and on. That basically similar species are colonized by similar organisms, and it is really difficult to understand the phenomena of host adaptation and their ability to cross species and cause disease in different species. Focusing a little on the swine, I'm not sure how well you can see this here. We just have a list down here of what would be termed recent emerging disease issues in swine. And the Swine Futures Project, I think it was a few years back, defined emergency disease issues as issues that could impact the industry, not just from a disease point of view, but from a public relations or export access point of view. And you can see we've had our share from, and these are essentially the earliest reports from the pig, where the extent of the organisms has been documented, and an assessment, and these are just my crosses, pluses and minuses, of impact on swine health, impact on human health, and impact on media hype, if I can call it that. So we can see that the big ones on pig health, which have been PRRS and circovirus, essentially having no human health perception of risk, at least, and probably reality, don't get attention in the media. So the fact that we've had two major viral pandemics in the swine industry in the last 15 years would be new news to most of the public. The fact that we've had perhaps other events that have got a lot less significance for swine health but are in the media, and you can see some of these. Salmonella typhimurium DT104. Most of you who were around in the 90s will realise it was like the MRSA of today. It was what was a newly emerging multi-resistant organism in a lot of species, including the pig industry, and it was prophesied that this was going to have major impacts on public health. It's still out there. Really, the burden of salmonella hasn't really changed with its coming or going, and it has been, I think, from a public health consequence point, not a really big deal, but it was a particularly important political organism back then. And if we go down, and I think the best current examples would be MRSA, which I'll speak to you mostly about now, and also obviously the H1N1 pandemic influenza. So these bugs emerge they have uncertain consequences for animal and human health, and they have very different impact with respect to whether the media and the blogosphere pick up on them as important issues. So the two that I'll just point out here and wanted to speak about today, MRSA, ST398, and I'll come back to talk what I mean by that, and the other organism, Clostridium difficile, and I'll talk about them because they have a lot of common features. Firstly, they're common commensal organisms that are found in healthy people and healthier animals. They are both opportunistic pathogens, so they can cause disease, and they have increased in public health importance, in incidence, in clinical severity over the last 15 to 20 years. Both of them were recognized as being important human pathogens before anyone considered that animals had any role in their epidemiology. It was considered this is a human hospital-related thing. Both of them, again, a lot of common ground, important nosocomial agents, meaning hospital infections. So back 10, 15 years, all that was talked about really was the risks of hospital medical treatment, being in a hospital or an aged person's home where these organisms were causing most of their problems. The other thing that has happened with both of them is that there's been a rise in the incidence of what are called community acquired. So cases that are occurring in John Citizen out in the public without being exposed to medical institutions like hospitals. And obviously for both of them, the fact that we have this increase in community infections occurring outside the hospital environment and the fact that we have potential animal reservoirs, that raises the question of, what is the importance, or is there importance of livestock as sources of these community-acquired infections? And the other little facet of it all is both of them have been isolated from pork. So it raises the issue of, do we have a foodborne crisis here? And so, the public relations of understanding this biology, which is complicated, not easy to answer, communicating it is a real challenge. And again, for those who would wish to portray the food animal industry in a negative light, this is easy fodder. It's easy to say, look, these organisms are coming. It's coming from the way we're producing pigs. We've been telling you this is going to happen. It's the end of the world that's been predicted. So that leads us to, how do we go about dealing with these? Just a little bit of background on the MRSA, and that's what I'll talk about in the rest of the available time. This is a publication rate for papers on MRSA, methicillin-resistant Staph aureus in animals. So the first isolates were 1972 in cattle, and you can see the red line here indicates here we're talking decades, here we're talking a 5-year period. So we were seeing, a paper every 5 years or so, and then you see a little trickle through here, and then we get into the new millennium, and there were isolates from cat and dogs, and the first isolates from horse, first isolates from pigs and sheep about 2004. Now we've got more than 50 papers a year. So we have an avalanche of information now of papers describing MRSA in different contexts, but in relation to animal production, food safety, those sorts of things. So we've gone from it not being something we recognize to something that we're getting saturated in information with. Just a little bit of, to explain how things happened, one of the standard methods for subtyping Staph aureus, and particularly MRSA, is a pulse field. So you see these gels, we chop up the DNA, we look at the banding patterns. It's a DNA fingerprinting method, and that is the standard method in many countries for how we look at MRSA isolates and try and do the epidemiological detective work. So this pulse field with SMAR1 enzyme is a very standardized technique. And just I'd just like to say, well, this study was actually one of MRSA from US West Coast public marine beaches. And one of the difficulties with these widely spread organisms is when you look in places, you very often find them. What happened in Holland? Holland is a country that has very low MRSA prevalence in the human population and in the hospitals. Only about 1% of all their Staph aureus invasive infections are methicillin resistant. US is above 50%. So they have a lot better situation. They have a search and destroy policy in hospitals. So if you're positive, you get isolated, you get treated before you're allowed into the wards and go for surgery. So it's very intensive screening and typing. What happened in 2004 was a 6-month-old, otherwise healthy girl with a congenital heart defect came in for surgery and was screened because it's a intrathoracic surgery, was screened for MRSA. They grew a bug out of her. That bug was untypable. They couldn't type it with the standard method, which meant it's a bit of a weird one. It just so happened in a narrow space of time, they got 2 other screening isolates that were also not typable with their standard method. And someone chose to look, because of the way they oversee the MRSA, that all 3 cases, what's going on, and it happened that all 3 were epidemiologically linked to pigs. And that's a picture of the little girl who was the index case. Her surgery went, she recovered, she's back home. She's still working on the family pig farm. There was no infection consequence, but there was, probably a global political consequence of her case. And that launched a whole lot of studies of, okay, what's going on in the pig world? Just a little bit of language. I mentioned before the pulse field technique here with the gels. There's a whole lot of different techniques that are used for slicing and dicing Staph aureus to subtype them for epidemiological and outbreak investigation reasons. What we have now is that this particular untypable weird strains are now called livestock associated strains for various reasons we'll come to. They're typically not typable with this standard pulse field method. They belong with a multi-locus sequence typing to a group, a family of organisms that are called ST398 or clonal complex 398. So that's the label that's stuck on these particular isolates that have been associated with pigs and other isolates. There's another method that they are exists with 8 types, SSC MEC typing. I won't get too much into that. And there's also SPAR typing, which is looking at DNA patterns in a particular protein gene. So what I'm going to talk about in the language, just so you can understand my jargon, is that we talk about the livestock-associated isolates as belonging to this ST398 family, if we call it that. And within that, there's a whole bunch of different SPAR types, probably about 30 that have been identified. I'm just showing you some of the more common ones, and they're indicated. So all these little T's indicate that they're a particular SPAR type that most often belongs to this family of unusual organisms that have been associated with livestock. The Dutch then went along and said, well, okay, we don't have any in people. Let's go and look at pigs. Lo and behold, about 40% of the pigs were positive. So this is big news in a country that is putting a lot of resources into controlling it. All the isolates were of a similar clonal group, this group that we're talking about. Non-typable MLST 398 and a couple of SPAR types. I won't bother about. They were also uniformly resistant to tetracycline. That's unusual in human isolates, and that leads obviously to the suggestion that, okay, use of tetracyclines in the industry may be selecting for MRSA. Very simplistic causal model, but certainly plausible, and one that is very hard to work through and see, is that really what's going on? They also looked at pig farmers, and this really where things hit the fan, because about 23% of farmers in the initial small study they did were positive. That was about 800 times higher than the background of the population. So all of a sudden you had an occupational group that was carrying this organism that they try and keep out of their hospitals at a very high group. And they actually changed their MRS screening procedures in hospitals to routinely screen pig farmers and cattle farmers in order to, before they'd admit them to hospital, because of the high risk associated with them being colonised with these organisms. And also it was then isolated from pork. There's been a lot of work done in Europe, not so much in North America. The Europeans have done a study of farms across many countries using dust samples. You can grow these organisms easily out of dust on affected farms, and you can just see the darkness indicates prevalence. So this is prevalence of farms. So in some countries, Spain, Germany, Italy, 1/3 to half of their farms test positive for having the MRSA. Some countries were negative, a little bit unusual, because there's so much trade in the European Union. But certainly in many countries, very high proportion of farms were positive for these organisms. The next thing they did was look at the SPAR types, and all I wanted to show out here was a couple of times. One thing, different countries have different patterns, so the pie chart really shows the red colour is a particular subtype or SPAR type of the MRSA. So we can see variability country to country. Interestingly, Denmark is all purple. The Dutch have very little of that particular SPAR type, so country to country differences And the understanding at the moment is a lot of these patterns are actually related to pig movement and movement of genetic stock country to country. So Spain looks a lot like Holland, and in Spain actually for many years has received a lot of pigs from Holland. So we're tracking these organisms around, and farm relationships may have as much or more to do with it than antimicrobial resistance. The thing to point out just here, and I'm going to show you a little bit more information, this one here that's predominant in Denmark is what also has been predominant in North America, and I'll just give you a couple of examples. The other thing, it started off as a pig problem, but seek and ye shall find, and there's lots of studies that now in pigs in various countries where we've seen the ST398, but also particularly in Asia, we find that's not the only variant that is in the pig world, and also in other species. So there's a bunch of reports from different countries to say these organisms, they're not a pig organism, they're certainly associated with livestock, and the suggestion that, normally we think that certain Staph aureus isolates are reasonably host-specific, but these ones are not host-specific, and the fact that we find them in many mammalian hosts may be that they've got more zoonotic potential than we might normally expect from an animal source. So that, again, is a hypothesis. Things happened. A study first done in North America with Scott Weiss's group was done in Ontario, and guess what? They found findings in a convenience sample very similar to what was seen in Holland. A little bit lower, but 25% of pigs, 20% of farmers. So big numbers. So immediately the focus shifted. It's not just Europe, it's also North America. And the thing to look at here is about 75% of the spar types were of this ST398 family. So there was more variability, but most of it looked like Europe. In the USA, Tara Smith published a paper which was basically a study of 2 farms in Iowa. One farm was positive, and 70% of the pigs were culture positive. The other farm was negative. Again, with the replication in the media, reports were coming out 70% of pigs in the USA are carrying this organism. Well, that was one production system, several sites, but the same flow of pigs. We did a study funded with the National Pork Board looking at slaughter pigs, and we found about 25% of pigs at slaughter. And again, remember at slaughter, things tend to be worse there because you got lairage and cross-contamination. So this is possibly around your worst case scenario, quite a bit lower than Holland, but still a lot of positive cultures. And these are nasal swabs from market hogs. Diverse spar types, but again, this same one, that purple one from Denmark, was the most common isolate that we got. Over the last 2-3 years, I've been involved in a study with Tara Smith at Iowa and Wanderson Gabrias at Ohio State. And what we did then was say, okay, it looks like it's here. We need a little bit of a broader study. And the National Pork Board funded a study that we designed to have 54 farms across the 3 centres. So 18 farms for each of the workers. And within each state, include 9 conventional, 9 antibiotic-free farms, and just see what was there. We had a lot of difficulty finding farms. Trying to do field research in 2009 in the flu pandemic, when you were looking at another organism with public health implications, there was a lot of respectful declines in terms of trying farms to find farms who would wanted to have their pigs tested. So we ended up with 45 farms enrolled, 24 conventional, 21 antibiotic-free, about 1,000 pigs, 154 people. What we found was we only found the MRSA on 4 farms, and all of them were conventional farms in Iowa or Illinois. So all the farms tested in Minnesota, which was 18, we found none of these organisms. We found about 4.2% of the pigs positive overall, again, because most of the farms were negative. But we did find about 18% of the people were positive, 29 people out of 154, but 24 of them were on 2 farms that had the highest pig prevalence. So you can see, obviously, when the pigs are when there's a high prevalence in the pigs, there's a higher exposure rate to the people, and that makes a lot of sense. I'll just skip over the next couple. Again, only to point out this same subtype, T034, was the predominant one. Okay, in Minnesota, we looked fairly hard and we were unable to find the MRSA, but we did have 98 isolates of methicillin-susceptible Staph aureus that we got from pigs and from people, clustered on 4 farms. And when we looked, 65, or the majority of these pigs were the same spar type, TO34, but they weren't methicillin resistant. So that points to the idea that this family is perhaps been in pigs for a long time, and the susceptible variants may precede the resistance variants. So a lot we don't understand. So what we've done is certainly we've found MRSA in market hogs and occupationally exposed people. In North America, this TO34 looks like it's the predominant variant. There's also another one that has popped up in several studies in Canada and in the US. But what hinders a lot of our interpretation of what this all means is that we know almost nothing about basic Staph aureus epidemiology in the pig. Because it hasn't been an important pig pathogen, we haven't put much time into it. And all the focus has been on methicillin resistant stuff, but we don't really know a whole lot about basic Staph aureus epidemiology. So what we're looking at from understanding the risks that we've got here is that, there is a high exposure risk for groups with direct livestock contact, and that includes veterinarians. There's lots of studies in lots of countries even showing that small animal equine veterinarians are at high risk for MRSA carriage, being culture positive, not necessarily disease. We have no data suggesting they're at higher risk of disease, just that they're at higher risk of carriage. And also some studies indicating that there's some reduced but real increased risk for direct family members of pork producers and of veterinarians, but there's no indication of significant community exposure. So some of the scare stories that we've got farms out there and they're going to be infecting the community. There's been two studies, one in Germany, one in Holland, that have pretty convincingly shown in areas with a lot of pigs and a lot of culture positive pigs that it's only the people that are handling the animals, or those, and that includes people in lairage at slaughter, and those direct family members that have increased risk. So it's a serious issue from a point of view of industry, occupational health and safety, and understanding what it means. For a general public, the evidence at the moment suggests there's not too much to be worried about. What we don't really understand yet is that we're culturing these organisms from people who were in barns with pigs that are colonized with this organism, and you can find it in the dust. So we, separating, are they truly colonized as these organisms set up shop in the nasal cavity, or are we culturing them from the dust on the hairs of their nose because they're breathing air for the barn? And there's a couple of studies now suggesting that most human exposure is actually quite short term, 24, 48 hours. So when people are continually exposed, they'll be continually culture positive if they go out of that environment. Certainly there's a lot more work to be done on that. The other part that we're trying to understand is, what's the burden of disease from a point of view of, the severity. If we are exposed, what are the consequences of this exposure? As to now, there's one reported death of an ST398 infection that I'm aware of, which was actually a methicillin susceptible strain. So after 5 years in Europe, thus far, the worst case scenario hasn't happened, but there's still lots of concerns about these strains adapting to people becoming more virulent. And Liz can tell better than I. There was a meeting in Washington, D.C. last week when I was teaching, so I couldn't be there. And one of the focuses now is looking at a molecular level at the isolates from pigs and the isolates from people. And there's certainly some, building evidence that there are actually distinct differences between the organisms that we're getting from livestock sources than from human sources. So they're still in the same ST398 family, but they appear to have some differences in terms of their ancestry.